Over the last 10 years or so, we've seen a revolution in weight loss surgery cases because there's been an evolution in the medicine. 10 years ago, what was called the gold standard surgery was a Roux-en-Y gastric bypass, which was a combination of making a small stomach pouch and then reconnecting the small intestine so that the food that the patient could take was restricted, and also there was what's called malabsorption. So that was a way of reducing calories and inducing weight loss. But the doctors found that there were a lot of complications from Roux-en-Y gastric bypass because they were creating more than one new connection. And anytime you create a connection inside the body, whether it be by staples or by sutures or a combination of both, there's the risk that there can be a leak. And a leak, if not treated properly and quickly, can be fatal. So the doctors decided that they were going to try to reduce the complexity of the surgery and began to do a procedure known as sleeve gastrectomy. And in a sleeve gastrectomy, about 90% of the stomach is excluded from taking in any food. And a long sleeve or pouch is created, again with staples or sutures, to restrict the amount of food and thereby restrict the amount of calories that a patient could take in. What the doctors were hoping is that by doing this gastrectomy without doing the connections, they could reduce the complications. Unfortunately, what we've found is that a staple line, whether it's in a sleeve gastrectomy or in a Roux-en-Y gastric bypass, can open and leak and cause the patient lots of problems. We're also seeing that despite the fact that surgeons know that if they get on top of this problem quickly and insert something called a stent, which is sort of a tube or straw-like structure which can bypass the leak and allow it to heal, they're either delaying in putting in a stent or operating at hospitals where stents are not available, and patients are becoming sick and even dying. So, unfortunately, even though the medicine has changed and the technique has changed, we're still having to help patients who have had sleeve gastrectomy go bad. If you need our help and want a free consultation, please call us at 212-233-5001. We are available 24 hours a day, and again, the consultation is free.